All right, we're going to go ahead and start our second round of Ignite presentations. And our first Ignite presenter is Dr. James Pittman, who we heard from earlier. And he is an assistant professor of psychiatry here at UCSD, and also the associate director of education and dissemination at the VA Center of Excellence for Stress and Mental Health. So just as a reminder, we'll have an Ignite presenter, and then I'll open it up for one question.
Whoever said this was exciting and not nerve-wracking. Good afternoon. Today I'm going to talk about a technology solution that we developed at the VA called e-screening. I'm also going to talk about a common process used at the VA called an RPIW that we adapted to use as a strategy for implementation. The VA serves about 9 million veterans each year. There are high demands for quality in a resource-scarce environment. Versatile solutions are needed to help providers do more with less while still providing excellent care. E-screening is a web-based program that can be used on computers or mobile devices. Patients can answer self-report questions in waiting room and information to integrate into the medical record. It can be tailored to a variety of settings for triage, ongoing treatment monitoring. In our research, e-screening improved rate of screening completion, clinical documentation time, referral to services, rate of and speed of access to primary care, completion rate of suicide risk assessments, plus patients liked it better. Our small San Diego team started finessing implementation of e-screening, and with national recognition, we implemented in 7 VAs with 50 on a waiting list. But like the man in the next picture, we needed a better strategy. So we contracted Gallup to collect implementation information from the frontline staff and leadership in different clinical settings. We contracted with them to learn more about workflow. We learned that workflow, sufficient staff and space, openness to change, and leadership engagement influenced successful uptake. Next, we partnered with our local representative of a national VA systems redesign program. Basically, these are the folks at every VA to help improve quality and efficiency using tools such as a rapid process improvement workshop, or RPIW. An RPIW is a systematic process in which stakeholders focus for several days of data collection, analysis, process mapping, and action planning toward improving a process. We adapted the RPIW to focus on how to introduce e-screening to a new programmer team, and we created examples of process maps, gap analysis, value propositions, communication, and action plans, and packaged them together to be used as a model for other sites. Essentially, we use an RPIW to develop an exportable guide that would allow others to do their own RPIW implementation of e-screening. RPIW was the process and the product. Our 12-member interdisciplinary team had representatives from several different VAs throughout the country. We branded our product the e-screening implementation playbook. Next, we started a pilot test to test e-screening playbook in 2 different sites that had internal champions. Both sites were provided the playbook, bi-monthly external facilitation, a site visit, and tech support as needed from the San Diego team. During the visit, we facilitated a formal implementation RPIW as outlined in the playbook for Site 1. The entire team participated, including leadership, and they developed a plan specifically for their program. The Site 2 champion decided not to conduct an RPIW and developed a plan with input from a few team members. During the site visit, we met individually with staff, introduced e-screening, set up staffing accounts, and problem-solved technical issues. We took notes during facilitation calls and the site visits, and then 2 of our team members independently reviewed the notes to identify challenges and solutions. We identified 4 types of challenges related to implementation of e-screening at each site. Problems with technology were prevalent, but most of the problems were with hardware, VA servers, and wireless connectivity, not with e-screening. The solutions were to reach out to the VA San Diego team. we did something like this. System-level barriers related to bureaucratic processes within VAIT, lack of enough education on using e-screening were also ubiquitous. Workflow and staffing was only a challenge in Site 2, the one with no RPIW. The solution for most of the problems, as I mentioned, was to reach out to the VA San Diego team. This may suggest that the playbook RPIW is a useful tool, especially for workflow issues, but that the external facilitation and education are still needed. The overall strategy of using an RPIW for implementation is promising. We are currently developing a larger study using RPIW implementation to see if it can work on its own or when and how external facilitation may be necessary. Thank you.
Okay, I invite you to ask Dr. Pittman a question.
We needed to continually provide some sort of external technical assistance. Have you thought through the sustainment of that and how that can be funded?
Yes, we have thought very hard and long about that. So what wasn't in the slideshow today and what in my talk was that we've been working with our national offices to develop, to get funding to develop a national version of e-screening. Currently, it can only be implemented site by site. And so what we're trying to do is implement it in a way that it actually goes out to all the VA facilities as a class 1 software, which is what they call. And when that happens, what will happen is that the VA IT system will then become an owner of the product. And so just like anytime we have problems with our medical record system or our email or anything else, we will have the VA IT to be able to be the infrastructure for the support for technology. So that's what we've been doing to plan ahead for that. So now our focus is less on how to provide that additional technical support and more on how to introduce this program to the clinical teams so that they can make it useful for their clinical setting.